Okay, so my patient is a 71-year-old male with a pain, edema, decreased strength and range of motion of right knee, secondary to elective total knee replacement surgery. Patient presents with deficits causing limitations in ability to perform bad mobility, transfers, gait, and gait. Patient was independent in all activities prior to surgery and has good family support. Patient requires physical therapy interventions at this time to resume normal activities. Therapy will focus on techniques to decrease edema and pain, as well as therapeutic exercise, therapeutic activities, and neuromuscular re-education to increase strength and ability to return to functional activities with decreased assistance. Two of our short-term goals are to increase right lower extremity strength to a 4 out of 5. And then we also need increase right lower extremity active range of motion from 0 degrees of extension, 0 degrees to a 0 degrees of extension to 90 degrees of flexion. Okay. The way that physical therapy can help increase your right lower extremity strength to a 4 out of 5, we'll be doing strengthening exercises to increase the strength on your leg.
Right.
And to increase right lower extremity active range of motion, we're going to be doing stretching exercises for you to gain your range of motion back.
Cool.
Does that sound good?
Sounds good.
Sounds
Does
good.
that sound the...
Hope you don't work me too hard. Just an old man.
So I'm gonna tell your wife that you're not behaving properly.
Oh God. She's gonna smother me in my sleep.
You've been drinking your medication, sir.
I have been drinking my medication. As you can see.
So, my name is Orestes. I'm a physical therapist assistant student from South University. Today I will be doing your treatment.
Okay.
And what will be your preferred name, sir?
Frederick.
Frederick. All right, Frederick. Nice to meet you. Is it okay if I treat you today?
Yes.
Perfect. Okay. All right, Frederick. So again, you have a right knee replacement.
Yeah.
Okay. And today what we're going to do is that we're going to work on strengthening of the right lower extremity. Right. We're going to work on strengthening your right leg, and we're also going to work on range of motion of your right leg. Okay.
So we'll be like moving it around,
Yeah.
trying to make it a little bit stronger.
Yeah.
Help me move because it's like a little stiff, so help me like stretch it out a little bit.
Yeah, so everything that we're gonna be doing for treatment is to get you back to doing your activities of daily living.
Cool.
Okay, we want to get you back to doing what you were doing before.
Yeah, I'm a big shuffleboard guy.
So the first thing that we're going to do, I'm going to see how strong these muscles right here are. Okay. So it will require for me to get my hands in there. Is that okay with you?
Sure.
Okay, sir. Can I go ahead and have you put your hands back here for me?
Okay.
Awesome, perfect. All right. So again, what's gonna happen is I'm gonna have you do this motion for me. Okay.
Mm-hmm.
Go ahead and do that motion for me. Okay. There you go. And then now what I'm going to do is that I'm gonna have you put it up. Okay. And then I'm gonna go ahead and push, but don't let me push. Okay.
Okay.
So what you're going to do is that you're going to go ahead and hold your leg here for me. Okay. Hold it there and don't let me push. Okay. Hold it. Don't let me push. Crescendo on. Crescendo off. No, but you gotta pretend you have a 3.
Yeah, yeah.
Okay. Alright. So go ahead and hold it there, don't let me push. Okay. So my patient is a 3 out of 5 right now. Okay. So now I'm going to take active range of motion of my patient's knee. We're especially looking for knee extension, but we're also going to do knee flexion. So I'm palpating for the lateral epicondyle of my patient's femur. That's where I'm going to put my fulcrum. My stationary arm, it's midline with my patient's thigh. And then the moving arm is going to be aligned with the lateral malleoli. And then what I'm going to ask my patient to do is to extend his extend his leg as much as he can. Yeah, that's good. There you go. Okay. So my patient has 30 degrees of knee extension, and then I'm going to ask my patient to bring his heel towards his right hip. Okay. So my patient has 80 degrees of flexion. So I got my patient's knee range of motion ranges from, did I say 30 degrees? My patient's knee range of motion ranges from 30 degrees of extension to 80 degrees of flexion. Okay, good. Okay, so now what we're going to do is that we're going to assess the gait part of the assessment. What my patient has going on, again, what I'm gonna have Frederick do over here is that I'm gonna have him ambulate for 15 feet with his rolling walker. I'm going to stay on his bad side, and what I'm looking for is to see how his the stance phase with the right lower extremity is, and to see if we haven't made any improvements from last visit. All right, Frederick, so what I'm gonna have you do is that I'm just gonna have you walk down and walk back, okay?
Okay.
Good. Go, Frederick. Try to extend that knee as much as you can, sir. There you go. We're going to perform the first exercise, which is a hamstring stretch. Okay, it's going to be passive, so I'm going to have the patient's leg. How you feeling, Frederick?
I'm good.
You feeling good? Yes, sir. Okay. So what we're going to do is that I'm going to get it until we feel a light stretch. Okay. And I'm going to hold this for 30 seconds. 4 times. So how was your day, Frederick?
You know, wife's been nagging me all day. I couldn't wait to come to therapy just to get away from her, honestly.
Man, you're talking a lot about your wife there, man.
Yeah, well, we've been together 80 years, you know, it's tough sometimes.
Wow, 80 years, man.
Yeah.
Do you guys celebrate an anniversary every year?
Sometimes, you know, just depends if we remember or not.
Do you guys have it on the same day every year, or whenever you guys feel like it?
That's kind of what we feel like it at this point, you know, it's like, who cares?
Yeah.
Yeah.
What's your anniversary date? This year, at least.
This year, it was Friday the 13th, which was terrible timing with the whole coronavirus. Matter of
So-
fact, I still have to go get checked for that, so you might want to be worried.
Sir, do you think you have coronavirus?
I don't know, you know,
Hmm.
it's going around, you know.
Do you think you're gonna die, sir?
Well, I sure hope so.
So you wouldn't have to see your wife anymore, sir?
Oh yeah, plus, you know, the human condition is permanent suffering, I'm just over it.
What about your favorite TV show, sir?
I've seen all the episodes. You know, like it doesn't get any better.
Did it get canceled because of the coronavirus?
I don't think so. If I look and it does, then we might be meeting death early today. You gonna take up all the 30 seconds?
Yeah, we gotta do it. We gotta do it.
Oh man,
You're gonna have very flexible hamstrings after this, that's for sure.
that's good. That's actually my tight side, anyways. Hey, super cool idea, guys, giving us a video a week before finals. Big, huge 170-point project in the middle of the crowd.
Okay, so now we're going to perform the second exercise. So what we're going to do is that I'm going to have my patient sitting on the edge of the bed, and my patient, and what it's going to do, Sir Frederick, so what you're going to do is that you're just going to go ahead and extend your leg here as much as you can, sir, okay? So we're going to go ahead and do this 10 times 3 sets, okay?
Mm-hmm.
Is that okay, sir?
Yep.
Alright, start breathing, start coming. 2. Okay. Good.
3,
Good. Good.
4,
Good.
5, 6, 7, 10.
Whoa, sir. What's going on?
I did 10.
You told me you took your medication today, sir.
I did, it's right there. 9, 10.
Okay, perfect. Okay.
Also want these short quads.
No,
I know, but isn't that what these are?
those are long records.
You sure though?
Yeah, 100%
I
sure.
thought those were laying in straight leg.
No.
Okay.
If you lay on your back with a bolster on your knee, and then you do
Yeah, I thought that was
that's
short.
that's shorter quads. This is longer quads.
Oh, right, good.
Yeah.
Alright,
I
and
have to skip that part.
we can do it over if you want.
Okay.
Alright,
Okay. Alright, there you
I
go.
wasn't thinking just gonna be a
Alright,
position.
let's do it again. Okay, so now what we're going to do is that we're going to perform the second exercise that we have planned for this patient. So what I'm going to have my patient do is sitting long hard quads, okay? Alright, sir, so what I'm going to have you do is that I'm going to have you just extend your leg all the way, okay? As much as you can,
Mm-hmm.
alright? And we're going to be doing that 10 times for 3 sets, okay, sir?
Okay.
Go ahead. 2. Good.
3,
3. Very good.
4, 5, 6, 7,
Good.
8, 9, 10.
Oh, good job. How do you feel?
I feel good.
You feeling good?
Yeah, it was definitely like I was getting tired by the 10, but I could do it.
Very good. Good job. Okay, you ready for the second set?
I'm ready.
Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Woo!
You like some water, sir?
No, I'm good.
Okay, sir, you ready for the third set?
I'm ready for the third set. 1, 2, 3, 7, 8, 9, 10.
Alright, that's good. Good job. Okay, so now what we're going to do is that we're going to perform our third exercise, which is laying on his stomach. Okay, Frederick, so now you're going to be laying on your stomach, and now what you're going to do is that you're going to bring your right heel over to your butt, okay?
Okay.
Alright, sir, go ahead, go up as much as you can, then down, and we're going to do this for 10 times 3 sets, okay?
Okay.
Go ahead and make sure you're counting, sir.
3, 4, 5, 6, 7.
How you feeling, sir?
I'm okay. 9, 10.
Okay, sir, take a break, and then we'll do 2 more sets.
Okay. Yeah, I just feel like I can't like do the whole motion, you know.
Yeah, you will have limited range of motion for some time. We're currently working on increasing the range of motion on your knee. Get ready for your second set.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good. Perfect, good job. Now we just got one more set.
Cool. Definitely feel like it's like a little bit looser from the hamstring stretch we did earlier.
Perfect. Ready for the third set?
Okay.
Here we go.
1, 2, 3, 4, 5,
Gonna slow down a little this one.
6, 7, 8, 9,
Nice.
10.
Good job.
Ooh.
Perfect. How do you feel?
Oh, not bad, not bad. That was a good one though.
It is 10 times with a 5-second hold.
Okay, so
All the
when
way
I
up
get to
here. Yeah, once your knees
here,
bent
I hold
as
for
much as
5.
I can. There you go. We're
2.
gonna hold it there for 5 seconds. Okay?
Okay.
We're going to do that 10 times for 4 sets. Okay?
Got it.
Okay, so that's one of the exercises that you're going to be doing at home.
Mm-hmm.
The second exercise that you're going to be doing at home is the passive stretch that we were doing, this one. Okay, and the
Yeah,
way
right.
that you can do it at home is by, if you have a dog leash at home, or you can buy yourself a
One of those.
stretching strap.
Yeah, okay.
And you can use it to just hook it on your foot, and then you can stretch your hamstrings like that.
Right.
Okay? And you're going to be doing that 4 sets of 30-second hold. And again, I'm going to provide you a paper that's
Okay,
going to
cool.
describe all of these exercises as well.
Yeah.
How many times you got to do it. Now, the third exercise that you're going to be doing at home is going to be sitting on the edge of your bed, or you can do it in a chair as well.
Mm-hmm.
Okay, remember the other exercise that we're doing, how you were getting your knee,
Oh, right.
your
Just
legs straight. Yeah, just
straighten
kicking
it out like that.
Yeah.
Okay.
Just kicking out like that, and again, we're going to be doing that for 10 repetitions for 3 sets.
Okay. Cool.
Okay.
Easy enough.
Good luck with your
Appreciate it.
coronavirus, sir. And
Hey.
your wife.
You know,
Bring it in.
we'll see what happens. It's gonna kill one of us. Alright, cool.
Oh shit.
So that's it, right?